So let's continue with the differential diagnosis of the gastric outlet obstruction history. So you have to differentiate what is the cause of the this obstruction. So first would be say stomach, because is now very prevalent. So the questions would be ask about the appetite, nausea, anorexia, malaise, weight loss, family history of CA in the family, like gastric carcinoma, ovarian carcinoma, thyroid carcinoma. Did the patient had any CA history in the past? So these are the questions regarding CA stomach. So continue with the differentials. So our second differential would be peptic ulcer disease. Okay. Ask about the burning chest pain or feeling of indigestion. So if the patient is complaining of these things, so ask when did it happen, how much time after food intake, and does it has any relationship with the food, and occurs after which type of food, frequency of burning, and does the patient took any NSAIDs or over-the-counter medications. Ask about the melena. So these are the questions regarding peptic ulcer disease. Our third differential would be, okay, ask the question if the patient is having gastric ulcer, so it aggravates with the food, because the acid release in the stomach, and after the food intake the acid will become released and it will aggravate the pain. The patient is having gastric ulcers, and if the patient is having duodenal ulcer, so it's relieve after food, because the acid will mix with the food and it will come in to the stomach with the food, so it will become neutralized. So these questions are with the peptic ulcer disease. The next would be acid ingestion. So ask specifically if the patient swallow acid by mistake or because of the accidental purpose. So this question is very important. Fourth would be if the patient is having problem of eating raw vegetables and her hairs or his hairs. So ask about the phytobezoar and trichobezoar. Ask about the previous history just after birth. Did the patient had any operation just right after the birth? Uh, this is for annular pancreas. Ask about the pancreatitis. If the patient had upper abdominal pain and admitted in the hospital, So ask about the pancreatitis. Did the patient had fatty food intolerance? And if the patient is having pancreatitis and he or she may had steatoria. And the next question would be, after attack of the pancreatitis, did the patient develop any lump at the epigastric region? So ask about the pseudo pancreatic cyst. And if the pancreatitis is very prolonged, so did the patient develop jaundice after that? And along with the jaundice, did he or she develop weight loss and complain of dark colored urine and clay colored stool with itching all over the body and recent onset development of diabetes mellitus? So these questions are for the pancreatic CA. Okay. Next question would be regarding trauma to the upper abdomen. Then ask about the questions of retroperitoneal tumor, because if the patient presents with the lump in the abdomen, so ask about these symptoms too. If the lump is not present, don't ask about these things. Did the patient having any difficulty in micturition? Along with edema in the feet, that is fetal edema. Ask about the CA colon questions like constipation, dark colored stool, blood in stool, and tenesmus, altered bowel habits. So these are the questions for the CA colon. So these are the differentials basically.